Well, good afternoon, everybody. It's Wednesday and time for some wisdom. We're doing a little series, just a short series on book reviews. So we'll get into that. But I hope everybody had a great Mother's Day and enjoying some of this lovely drenching of the plains and getting some water for our plants, especially for those of us that lost a lot. Getting some in has been nice. Today I'm going to talk to you a little bit about a book that's just really near and dear to my heart, a book called Estrogen Matters. It's a book by Dr. Avrum Bluming and Carol Tavris. Tavris. She's a PhD. Interesting, Dr. Bluming is a medical oncologist and with amazing credentials in here. And as you read this book, not only will you learn about the importance of estrogen, which I'm going to talk a little bit about today, but also the fact that both his wife and daughter developed breast cancer and ended up taking hormones. So just as a quick aside. But the main thing about this book, a couple things. I'll walk through that. But the book is based on peer-reviewed literature and very evidence-based. And this particular book is not even really geared in toward what I would consider bioidentical hormones. It really talks a lot about both Premarin and Provera being a synthetic progestin. And it's great information, but at the end of the day, why not give your body the hormones that it actually recognizes, and because we have the availability to do that. But nonetheless, the book is quite valuable for helping us understand the ins and outs and some of the literature. And what we know through the information in this book is estrogen does not cause breast cancer. And I think that is an idea that is so difficult and so hard to overcome the myths and the information that people have received over time. And I think the difficult thing too for many people to understand about estrogen is that when we are a friend or loved one is diagnosed with a breast cancer, and someone tells you that the cells of that breast cancer have estrogen receptors, the cells have progesterone receptors, there is just this innate feeling that, oh my goodness, that must have caused it. But the reality is that all breast cells have estrogen receptors and all breast cells have progesterone receptors. We come like that. So if there is a tumor that has these types of receptors on their surface, they are more like a normal cell than an abnormal cell. And cancer in and of itself is a reflection of abnormal growth, and every cell in our body has the potential deep inside to become a cancer. What causes that is not well understood, but we are getting there. And it does appear that at the end of the day, we see significantly higher rates of cancer in people that have metabolic issues, particularly related to sugar and insulin resistance. Now, does that cause everything? Absolutely not. We know that there are other things out there. But particularly in terms of breast cancer, we still have a lot to learn. And despite the fact that there are genetic aspects of breast cancer, those genes don't seem to be related to estrogen. They're related to tumor suppressor genes or other types of genes that allow for unbridled growth. So just as an aside, but let's get back kind of to our book about Estrogen Matters. We know that estrogen does not increase the risk for breast cancer, and it's not a disease of too much estrogen, and even survivors can take estrogen. Estrogen is the most effective treatment for all symptoms of menopause: the hot flashes, vaginal dryness, joint pain, We know that it protects the heart and the brain. So these are important aspects of it. We know that there's no current way to really prevent Alzheimer's except for estrogen. Estrogen has been shown to reduce risk. We know that 7 times as many women die of heart disease than of breast cancer, and women who are breast cancer survivors die more commonly of heart disease than breast cancer alone, and that those women who go back on hormone replacement therapy can decrease their risk of dying from heart disease by 30 to 50%. So this is important information to know. Also, women on hormone replacement therapy live longer. We know by 3 to 5 years, depending on what study you read. And some of the diseases that can affect us as far as aging is concerned, osteoporotic fractures, more women die of osteoporotic fractures, or as many women die of osteoporotic hip fractures as die of breast cancer. So if we can prevent that, we even have better results long-term from a longevity standpoint. And there's absolutely no evidence at all for many of the recommendations that women get to take the lowest dose of hormone for the shortest amount of time. We just don't have any data. I'd like to take a moment or two, for those of you that have time, and read just a little bit about the information as far as some of the studies he reports, just kind of read out of the book about the findings as far as the role of hormones in breast cancer. A 1986 study led by an epidemiologist at the National Cancer Institute found no statistically significant increased risk of breast cancer among women on Premarin. Again, this book really sticks with more Premarin and Provera, even among those who've been taking it for more than 20 years. So there's one study. There's a meta-analysis of 22 studies in 1988 that found no statistical association between estrogen replacement therapy and breast cancer. A 1991 study led by epidemiologists at Boston University School of Medicine found no increased risk of cancer among Premarin users. 1991 analysis of 28 studies by biostatisticians at Vanderbilt showed no increased risk of estrogen replacement therapy in breast cancer. And in 1992, the first randomized double-blind placebo-controlled study, the highest order of study, was published. 22 years earlier, Lila Nachtigal and her colleagues at New York University had randomized and assigned 168 postmenopausal women who were continuously hospitalized in a mental institution to receive hormone replacement therapy versus placebo. After more than 2 decades, 11% of the women taking placebo had developed breast cancer, and none of the women on HRT had developed any breast cancer. And because women who undergo biopsies for benign disease have slightly increased risk for breast cancers, researchers followed 3,300 women who had benign breast biopsies performed at Vanderbilt between 1958 and 1960, and the median duration of follow-up was 17 years. And in that study, published in 1989, women who were given estrogen following the biopsy, even those with a family history of breast cancer, did not subsequently have an increased risk of breast cancer. So it really wasn't until 2002 when the Women's Health Initiative came out, and the concern there was that there was a higher risk of breast cancer in the arm of the study in the women who took both Premarin and Provera. But subsequent follow-up and deep diving into that study showed that really at the end of the day, there was not a statistically significant increased risk of breast cancer. The other thing that they've studied is women with BRCA1, BRCA2 mutations in their genes. And it was thought that if we lowered estrogen levels by removing the ovaries, there should have been a significant decreased drop in breast cancer risk, as many oncologists believed. But indeed, this was not necessarily the case. So it was concluded that among postmenopausal women with BRCA1 mutation, estrogen use, which averaged 4 years in a couple of studies, was not associated with an increased risk of breast cancer. They just had an increased risk, period. And it was because it's a tumor suppressor gene. It has really little specifically to do with estrogen. So at the end of the day, this is a really interesting book and goes through many of the aspects of issues with women's health and where estrogen actually has positive benefit. We know it helps protect your heart, your brain, and your bones, as well as diminished risk for macular degeneration and colon cancer. So estrogen does matter, and certainly all of you who have come through here know that it does, and estrogen can be exceedingly beneficial in all aspects of life, even in women who are breast cancer survivors. So I hope this has helped you in some way, and if you would like a deeper dive, I really suggest that you read this book. It can be exceedingly valuable for you and maybe other women who are having to face some of these issues and who are truly just scared to death about this hormone and it's what they think its potential to do harm is, because at the end of the day, it's really lack of estrogen that does more harm than having estrogen on board. Hope this has been helpful for you all. It's been kind of a long wisdom today, but I think it can be of great value. Also on the email that I have sent out this week is an invitation to a wellness retreat that is coming up on the 22nd of May, where I will be talking about sleep and skin and sex. And there will also be my good friend Leslie Bumpus is running this. There'll be a yoga event there. Leslie is a clinical nutritionist, which will spend quite a bit of time on nutrition. And then another friend, Dana Williams, will be there, who is a strength coach, and we'll be doing some work within helping us understand our strengths and how to use those strengths to benefit the world and to find meaning and purpose. So if you're interested in something like that, it's a full day. It's about out at a venue about an hour and 45 minutes from north of Dallas. So might be a fun thing to grab a couple girlfriends and consider coming to. Anyway, I hope you all have a great week, and we'll talk again next week.